Proceed with presentation by Mr. Ravjot Kumar. Do we have you here? Yes, thank you. The topic is Telemedicine, Duty of Care for Seafarers. He's founder and director, 3Cube Medicare Private Limited. Sir, the stage is all yours.
I decided to walk here quickly because I know we're all running behind time a little bit. Taking from Sir, I am not to blame for it. First of all, a very good evening to everyone. Thank you to Maddox for giving me the opportunity to speak here on a topic which is so dear to me, and I need to find the presentation is on. Thank you. Sorry. Okay. So, thank you everyone. I'm going to try and keep the discussion, or not the discussion, the presentation very focused. But I would like to start with something because it's the beginning of a new year. We had a dream that we wanted our seafarers to be fit and healthy when they join a ship. That gave birth to something called as pre-employment medical examinations. We had a dream that our seafarers should stay healthy while they are on board. Then came some more regulations. We understood that every time we had a dream is because there were challenges and problems being faced, which is not going to go away, no matter how much we wish. Things will evolve. Today, in a day of connectivity, from technology being a boon, we talk of it as a bane at times as well. But what's the solution? One is we can talk about it and raise awareness about the problem. But we wouldn't move forward unless we decide that I have a dream that I want to overcome this problem. I will do my bit in whichever way I can, in my professional ability, in the skill sets I have, in the skill set that I can gather, to make sure that we deliver the very basic duty of care for our seafarers. On that starting note, as an innocent dream back in 2008, when I was doing my biomedical engineering, I wondered whether there would be a day where we could just call up our doctor and speak to them and say, I have this problem, what should I do, what medicine should I take? Because for all of us here, we have experienced the concept of a family doctor. All of us here at some point have experienced the concept of a family doctor. And what we would do is, I still remember very fondly, my mentor to the maritime medical side, Dr. Ranveer Singh. The lessons that I have learned from him about always doing what you can in your best ability without have a dream and go for that dream. Because when I first started shadowing and tried to understand what is pre-employment medical examinations, why is it that we still have seafarers who are sick if they're supposed to be healthy, because everybody said they're healthy. And that dream, and I remember he was my family doctor, so whenever I had a stomach upset, I still remember calling him up and says, "Beta, you'll be fine." And it worked. 50% of the time, my parents were fine because he said I'll be fine. And I was 75% fine because my parents were comforted that I'll be fine. So, in medicine, dialogue, compassion, follow-up is as important as good skill sets to diagnose and treat, for which you require a very good team. Of course, everybody requires teams, growth, education, that's part and parcel of it. So while the whole world has moved when it comes to telemedicine, and I put this slide up because I was told to talk about telemedicine, which is a subject which I love talking about. And they said, what is the evolution of telemedicine? I said, yes, there was the telegram, there was the telephone, then came radio, which was the most famous. We still refer to RMA at times as radio medical advice, though radio is no longer used most of the times. I don't think it's used anymore. Then of course there was the internet, the age where you could send an email or make a call, which was better, especially when the vessel was close to shore. And then there was COVID. I think the biggest evolution for telemedicine was during COVID. That's when probably people actually realized that healthcare can be achieved through good remote medical consultation. It's not that it didn't exist before that. It very much existed. But the value or the potential was capped in fear of that may not be a right way of treating, or in fear of, how will they know without actually seeing the patient? Or in fear, how will they know if they just ask me some questions? The fact of the matter is, as I said from the beginning, 50% of diagnosis is in the conversation you have with the patient. 50% of understanding underlying concerns is spending that 2 minutes more with the patient. And of course, there has to be effort from the patient side. I like Dr. Benani's slide where he said, when you have someone going for a job, disclosure is nil. But when you have a patient, he discloses more than actually he may have a problem also. So, of course, there are points and different stages, but as healthcare providers, what we can do. And when I was preparing the slide, because we're crunched for time, I said, what is the objectives of telemedicine? And the key objectives that I felt for telemedicine, apart from those that are on the screen, is to provide quick, prompt assistance, quality assistance, good follow-up, and be able to take care of seafarers when it comes to a medical case. Very often, when we talk of telemedicine, we consider it as one way, or at best, one call, a patient schedules an appointment with a doctor, they speak once and the matter closes. That's 90% of all telemedical services, or if you look at any of the systems, that's how telemedicine works. But telemedicine is made up of two very important words, tele and medicine. Tele is a form of communication, which doesn't have a limit. You can do it as many times as you want. And medicine is basically what you're providing, the service you're providing for. So while fundamentally, operationally, people have capped it as a way of providing service, I believe telemedicine is something that should be integrated with a lot more aspect of things. There is health and well-being in that. There is, making sure people are aware of illnesses. And there is proactive checking. We spoke a lot of chronic illnesses. I didn't want to add more questions because I saw sir and I said, if I ask one question, then he'll say your speech is cancelled. So I said, no, I think I'll reserve maybe a minute to talk about this. I think we talk about guidelines, what should I do, not do, etc., what I can choose, what I can't choose. Yes, everyone is bound by some limitations or restrictions. But I personally believe, why not we change the perspective? And somebody did mention it. Why don't we try to create an atmosphere where we encourage it for the seafarers to disclose? Now everyone's going to say, how is that going to happen? It's their employment address. By clarifying what makes them fit, what makes them to work on their fitness, and what makes them unfit, and unfit why? Why is it a risk for them in life? It requires dialogue, it requires communication. I think if there's refresher courses for doctors, and there are first aid courses and medical courses even for the seafarers, I think there should be a chapter included in that, what you should watch out for. When we treat cases on board, we find people with a lot of chronic illnesses. And the idea is not that you're unfit, the idea is keep it in check. Don't let it get to a level where you require medical assistance to a point where you can't serve on board. So of course, different situations, different circumstances, there's so many things to talk about. So how do we achieve this? I just wanted to kind of, before I come to the next slide, when we had this dream that we want to achieve something, we want to make sure the access to healthcare is there. And when I had this dream many years ago, there were many reasons for people to believe that there's no need for such a thing in the industry, as transparent and honest as I can be. Because, well, seafarers generally are healthy. Seafarers don't have medical issues. Of course, that debate is silenced since we saw the previous one where we know there are a lot of illnesses that we don't come to know and they aggravate on board. So, what's our first response to provide a seafarers? It's very essential. I'm just sharing this slide for information. Of course, it talks a little bit about 3Q as well. That what we have done to provide prompt medical assistance to our seafarers is we've created a team because we've turned the word from telemedicine to a virtual hospital. We said people feel comfortable to say, I'm sending you to a hospital, I'm sending you to a doctor. So we say you're reaching out to a virtual hospital. As hard as it may seem initially to convince people, when they start seeing the service, they understand because it's not only having a 24/7 service with a number of doctors available, it's about having specialist panel and not segregating mental health and physical health. Something that we've been talking a lot in the industry is because if your body is unwell, your mind will eventually catch up. If your mind is unwell, your body will catch up. Of course, maritime is also a global industry. So how has this impacted? What has it done for in our case? As if I use us as a litmus test, that is this concept of providing medical assistance going to be of any use or helpfulness? Because when we started, I would say similar thing. Will it work? Will it not work? Who will call? Will they really want to talk to you about medical illnesses? Will it really help the companies? Companies might be apprehensive that they'll find more issues with seafarers. Nobody will call. There were a host of challenges, but we said no. Our objective is providing our seafarers with prompt, efficient assistance. What can we do about it? As a result, with God's grace, today we're looking after over 1,600 vessels. We've dealt and treated more than 22,000 medical cases on board, which have resulted in avoiding a lot of port visits, medical sign-offs, evacuations, etc. Always a very, very sensitive topic to talk about. But since we're also in a medical and commercial forum, it's important. When we talk about avoiding, and this is not, say for example, because I'm putting the statistics out of what we do, but quite honestly, I'm sure this is being done by the stalwarts from before as well, where they prevent port visits, where they prevent medical sign-offs, and also recommend where required. The point is, when we use the word preventing a port visit or preventing a diversion, it's not always negative, which sometimes gets construed. It's about being able to understand from a specialist opinion that this particular case is fine and can be managed on board, and more importantly, taking the seafarer in confidence. Something that we have managed through our care, something where we have now identified that a lot of seafarers are very proactive in coming up with health concerns. And people think is health concerns bad. I think I'm very fortunate that in this forum there are people who are using our services also can be as good feedbacks for this in terms of a service. But what I mean to say is, people reaching out for help is also not negative. It helps solve the problem a lot earlier before they start limiting their workability. I mean, doing physiotherapy sessions online, getting people with minor back spasms to start working again, people with frozen shoulders to start exercising and doing physiotherapy, doing thorough clinical examinations to identify or differentiate as much as possible between malingering versus genuine cases. This is all what comes under the power of trying to deliver duty of care. And that again there is got to be the collaborative approach of the team and the skill sets. Understanding what life at sea is also. Explaining the seafarer what his or her decision might lead to and how our concern, because eventually we have many times, skip to the next one, we have many times when people go for port visits, and we all know port visits sometimes the shore stop is very small. They don't get the actual care. We have seen cases where a blood pressure and an ECG has been done by a dentist and they've been sent back on board. We have seen when a general physician has checked a cavity and let the person go back. Now, let's put it this way. If you're sending somebody to port, the least you want them to be seen by the specialist they require for. That's the least you would expect. So, being able to give that clarity to the master, helping him or her decide through the agent that this is what is required, I mean, at least make sure that is done. If you need an ECG, we need an ECG at port. In terms of the cases, I think we've seen all the kind of cases. The only difference, this is the kind of cases we get to see. And I think injury stands at a very, very similar number of 13% and 11%. I saw 11% on one presentation, 13 on another. And here for us, it's 13% as well. Dental is huge. I know a lot of companies will work on that because you can't really treat dental issues on board. So probably something, if the guidelines do get discussed, dental perhaps would be a good point to also put in there, check by a dentist to ensure that a cavity is proper, or if not, and things like that. Psychiatry or psychological cases, I think, we talk about it being 3 to 5% of the cases that we get to see. But I think it's stayed more or less the same, and that's kind of resonates with the population you get to see on land. Perhaps a little bit more higher on land because our seafarers are expected to go through some level of check before they get on board. And even if they do not, generally people who choose seafaring as a job option and have stayed for several years have got the aptitude as well as the adaptability in their mindset when they're on board. So the cases are a little lesser than what you would see in general. Do they not exist? They do. Why do we talk about it so much right now? Because unlike cardiovascular, which we've been talking since 1970, 1980, unlike musculoskeletal, which we've been talking for so long, mental health is a newer medical concern which needs to be given the same importance. And probably, hopefully, similar kind of solutions as what we have for the air. If we do a 2D echo, if we do a TMT test for everyone above 45, and we do a psychometric assessment only when the seafarer joins for the first time in the company, we assume that the mind and the heart are functioning in different ways, which is again important food for thought or discussion. Captain Basin mentioned this. A very important aspect of telemedicine, I believe, is creating the strong bond between shore and the vessel. Making sure the master knows that there's someone looking after them at all times. Making sure that the seafarers feel that they have awareness. You know, where we start with Malix, I think back in 2012, Captain Chadasa was here. We started something called as the health portal. It was one page of a health awareness article that was printed, I think every month. And everyone asked me, why are you doing this? And I said, the method to make people understand health or understand anything is first raising awareness. Today, I realize that's the most key component, and it continues through whatever we do. The fortnightly awarenesses that are sent, the campaigns that are run, what we've seen is that the seafarers feel more comfortable. We've had questions like, how many times can I reuse the oil if I've used it for frying? We have questions like, okay, how do I use unwinding exercise to get refreshed before my duty? If I've slept less hours, what can I do to kind of focus back again? What is the difference between presentism and absentism? Absentism, we know what present. So many things, right from yoga, deep breathing exercise, all of these through a series of awareness. And it just doesn't end as a one-way send out. It's basically working with them, taking their feedback and giving them information they want. Because if we want to treat our seafarers like our family, if we want to treat them, the first thing I have to be confident about, would I follow that? Would I like to see it with the same frequency? Would I reach out to the same set of doctors, or would I reach out to different doctors? I think that kind of sets the tone, and when we call them family, then you treat them as family to the best that you can. Even if family were restricted, during COVID no one could get off. But everyone tried whatever they could. So of course, running survey campaigns, over 18,000 seafarers, you understand what their issues are, concerns are, and then using that data to kind of assess what can be done with seafarers, what activities can be done, or what awareness initiatives can be started so that the master can give feedback. These are all parts of telemedicine. We unfortunately think telemedicine only is an aspect of providing the medical assistance, and also in case of dire emergencies. Last but not the least, how will you treat if there are no medicines? Well, we've heard a lot that the medical chest is lacking, is not sufficient, but quite honestly, I was amazed the way the doctors can use the medical chest to treat maximum number of problems. Maybe a little older medicines, they definitely require revision. I was just talking about, we require some more medicines. In this universe now where we have access to so much more, the alternatives, one, are not so expensive, and two, are far better. So it's a win-win to get them on board. So there are efforts in that. It's great to see that medical chest recommendations are coming out and the new regulations coming out, flag states, because this is very essential. I've been part of several studies where we published a paper on how to manage the medical chest, because often what we realize is on board when we want a medicine to be used, the master is unaware exactly how to find that or where it is, what class is it, what is it used for. And some of them unfortunately you go by the guideline of the guidebook will not find that medicine, because when you travel the world, you're going to have different brand names, different formulations, etc., etc. So for the master to have that one access that I can call up and say, is this medicine the same? Should I use this? How do I manage my inventory? Compliance on one different aspect. Compliance is we all know when the inspections take place. Making sure the medical chest is compliant with the certificate, but also making sure the medicines are there which need to be there. Controlled substances are correctly labeled and kept in care. One would say that when we're talking of telemedicine, why are we talking about all this? Because telemedicine would be incomplete without the ability to, I have to talk about mental health as well shortly. But telemedicine, mental health first. So with mental health, of course, when we talk about it, mental health is a huge issue. And I really liked it how there was a reference to anxiety being issues, anxiety-driven problems. I'll be very honest in mentioning these are kind of cases that we get to see. We've broken them down for stat data for people to understand what are the kind of cases we get to see. Anxiety is right on top. Sleep disturbances may not always be psychological, but they lead to psychological issues. Especially when we talk about lack of focus, irritability, anger, frustration, lethargy. It's linked a lot with sleep. You must, there's a forum where you all will advise me on how difficult it is to get a good sleep on board. But this is a challenge, what can we do to cope with it? Stress, somatic symptoms, so on. But what's more important is, in all the psychometric assessments that we have done so far, seafarers are generally anxious. And it's not just seafarers. Most of us in today's day and age are anxious. We are either worried about what will happen next, we are either worried about who will tell what about us, or about anything which will not be related about. I mean, it may not impact us, but we'll be anxious. But anxiety is a part of our life. So when we do these assessments, when we see there's a higher dependency, or there's an issue of anxiety, or these other kind of concerns that come up in good psychometric assessments, which I think is an important key to identify the mindset or to help the mindset, is to also give them coping mechanisms. It's like saying that you're diabetic or you're pre-diabetic. So there's one thing, at a pre-employment stage you might say you're pre-diabetic, you're fit to join. But there's another thing to say you're pre-diabetic, fit to join, but on board, this is what you should do to prevent it to become diabetic or to prevent you from having a medical concern. Likewise, this being at a pre-check level, to do that and say, if you get anxious, which you might get because it's a natural response that you might have, this is what you can practice. So there are ways and coping mechanisms. Will they always be successful? No, but I'd rather start focusing on where it will be a success and prevent issues, then be worried about if it doesn't work, what will happen. If it doesn't work, we're there to provide the assistance. But if it does work, it prevents a major issue. So I think, again, goes back to I have a dream. Last but not the least, why did I speak of these various elements when it comes to telemedicine? I feel telemedicine is incomplete if you're not building a connect between shore and the vessel. The doctor will not have, or the team will not have that kind of a rapport with the master and the seafarers. We spoke about the family doctor concept. It's very important to make sure you have the medicines and both the doctors understand what medicines are available and the master understand what the medicine should be used for, under what guidelines. It's important to provide good professional medical opinion, not only as a first response in cases, but also from specialists where and when possible. And last but not the least, training is an important aspect of it, which perhaps for another session, another time. I've crossed for 1 minute, sorry for that, but thank you very much, everyone.
Thank you, Dr. Utsa. May I request Captain Kamachada to present a token of appreciation to Mr. Rabjot Komal.